Go ahead.
அனைவருக்கும் வணக்கம். நான் டாக்டர் ஹேமா வைத்தியநாதன், Senior Consultant and Fertility Specialist at Oasis Fertility, Chennai. So, இன்னைக்கு நாம இந்த செஷன்ல வந்து let's understand about this topic, Understanding Fertility. So, fertility can be defined as the dictionary definition goes like this: the state or quality of being fertile. So, இது ஒரு dictionary definition அப்படின்னு எடுத்துக்கலாம். So, but the fertility is the ability to have children, the ability to conceive and get pregnant and give birth to children. So, அந்த ability தான் நம்ம fertility அப்படின்னு சொல்றோம். So, human fertility அப்படின்னு நம்ம பார்த்துட்டோம்னா நம்ம peak human fertility. So, எல்லாமே நார்மலா இருந்தாலுமே the chance of pregnancy per menstrual cycle human conception ரொம்ப கம்மி. அது around 33% தான் maximum இருக்கு. So இந்த peak human fertility per cycle conception is only 33%. So there is other statistical method அதாவது நம்ம இந்த fertility analyze பண்றதுக்கு. So geographical basisல. So fertility rate அப்படின்னு ஒன்று calculate பண்றாங்க. So it is the ratio of live births in the area to the population of that area, which is expressed in 1,000 population per year in the fertility rate or definition. So this fertility rate is calculated throughout the world. So there is also this study or statistical analysis of the global fertility rate. So global fertility rate from 1950 to 2021 there is a significant decline in the fertility rate. As we can see here in this graph, it is just in the downward trend. So fertility rate is reducing throughout the world, and it is a very concerning problem. So let's understand more about fertility in this session. So I'll focus only on fertility and infertility. So the requirements for female fertility. So the requirements is we need a functioning reproductive anatomy. And not just that anatomy. So we want the normal functioning of the organs, which is the normal physiology. So for reproductive anatomy, so the major reproductive organs in the mother, it's vagina, the uterus, the fallopian tubes that is on both sides of the uterus, connecting the uterus to the ovaries, and we have two ovaries. So these are the major reproductive organs in a female body. So not just this, we also require coordination of fertility from the brain. So in the brain, we have a producing organ which is known as the pituitary gland and the hypothalamic area in the brain. So we need a normal brain function also to regulate the reproductive function in both men and women. So for a normal functioning fertility, we not only need a proper anatomy, we also need a proper physiology, that is a proper functioning of the axis from the brain to even including the thyroid, adrenal glands, and the reproductive organs. So not just the organ physiology and anatomy is important. Also, we require an adequate sexual function in a female, and also for a female's body to accumulate the sperm, which is a foreign cell to the female body, and also to accumulate the fetus, which is a foreign antigenic content in the female's body. The female body should mount a normal immunogenic response when she is exposed to the sperm and the fetus. So this immunological health is also important in a woman's body to maintain fertility. And also most importantly, adequate nutritional status is important in a woman's body for a good fertility status. So adequate health status is also important. Also any background long-term health issues can also indirectly affect the fertility status of a person. So it is important to maintain nutrition in the body. So only if there is a proper nutrition and proper health in a woman's body, it supports the growth of the fetus, especially the oxygenation and providing nutrition to the placenta, via the placenta to the fetus. So likewise, the requirement for male fertility is main requirements is to support the production of normal spermatogenesis. Okay? Next is to have a normal ductal system. The sperms, even if it is produced in the testis, to bring the sperm to the outside, the ductal system should be patent without any blockage. So we can say that we need enough healthy sperms to be produced in men with normal sperm count, with normal motility, and also most importantly, the sperm has a very biological structure. It has a head, which carries the DNA content from the male to the fetus, and also it has a midpiece and the neck, or we call, and a midpiece and a tail. So it has a specific shape. So even if this shape of the sperm is affected, it significantly affects the way the sperm fertilizes the egg, the way the embryo is formed can be affected. So we just want a normal sperm health in order for maintaining a male fertility. The normal ductal system without any blockage is also important to bring the semen to the outside. And any blockage as a result of infection or even because of any abnormalities by birth can also affect the fertility in men. So if that is about fertility, what is infertility? So infertility itself, there is a definition for infertility. There is a requirement for us to diagnose infertility. So the dictionary definition goes like this: the difficulty or inability to produce naturally. But for us to make a diagnosis of infertility, what we are looking for is if the couple has been trying for 12 months of time. So, and if they are having unprotected sexual intercourse, that is what we are looking. And even after 12 months of trying without the use of any contraceptive measures, if the couple has inability to conceive, then we diagnose infertility in that setup. So infertility, if the definition goes like this, there are types of infertility. So infertility can be a primary infertility or secondary infertility. And how do we define this? So we call it as a primary infertility. If the couple has never had a pregnancy before, then the category is a primary infertility. But if the couple has been pregnant before, regardless of the outcome, whether it is a full-term deliveries or whether it ended in a miscarriage or an ectopic or an induced abortion also, if the woman has conceived before, then it is a secondary infertility. So it is important to categorize the type of infertility initially itself for us to understand the reasons behind infertility. So there are some causes that are specific to causing secondary infertility and some causes are specific to primary infertility. So it is at the outset it is important to differentiate the type. So and also the causes of infertility. So for a pregnancy to happen, we know that there is a contribution from both the sperm and the egg. So likewise, if there is infertility, male factor problems as well as female factor problems that is causing infertility is of equal type. So it's equal factors are there. So both male factor and female factor contribute equally to the reason for infertility in a couple. And there are a few fraction that remains unknown causes for infertility also even after testing. Some of the causes cannot be identified. In that category is known as the unexplained form of infertility. So what we understand is that infertility is not just a female issue. So even male is equally contributing to infertility problems nowadays. So let's also understand if that is all what we saw about infertility, the diagnosis, how we categorize infertility to primary and secondary infertility, and about the major causes or the major factors for infertility is what we saw. So to achieve a conception, so there are three main events. So these main events are necessary for pregnancy to occur. So also these events has to occur in this particular time for everything to happen sequentially. So first is ovulation, has to be proper. And then after ovulation, there is fertilization, which is the meeting of the egg and the sperm, and then by which the egg is fertilized. And then there is implantation, which is the embryo which is developed in the fallopian tube, moves into the uterus and gets implanted into the uterus. So these three main events are seen as important events in formation of a conception, formation of a fetus. So ovulation is a process by which this mature egg from the ovaries released, and this this egg is picked up by the fallopian tube, and then it traverses and transports the fallopian tube where it makes the sperm. So this ovulation process is an essential physiological event that happens during the menstrual cycle, usually in the mid-cycle of the menstrual cycle. Then this ovulation is seen as a very important physiological event that is necessary for conception. So any factors or any problems that affect ovaries and this ovulation can lead to infertility issues. So this ovulation problems, ovulation issues is one of the very common causes for infertility in a female. So any diseases affecting the ovary, like endometriosis problems, that is developing cysts in the ovaries, or polycystic ovary syndrome problems, or sometimes egg reserve, the poor ovarian reserve. All these can affect the way women ovulate, and if this ovulation, usually what we use the term anovulation. So if there is a problem with ovulation, then it can affect fertility significantly. So hence we see that ovulation is an important physiological event that is necessary for fertility. So after ovulation, that is fertilization. So the fertilized egg is picked up by this end of the fallopian tube, and this fertilized egg transports in the fallopian tube where it meets the sperm cells. Here at this part of the fallopian tube is the where is the site of fertilization. So where the egg is fertilized by the sperm cell, and once the fertilization happens, then there is a period sequential development of the embryo happens. So this embryo develops, or it undergoes further embryonic development as it traverses through the fallopian tube, and once it reaches a particular stage known as the morula stage, then it reaches the uterus. So once it reaches the uterus, it develops further, and then it undergoes a important physiological process known as the implantation, where the embryo gets implanted into the endometrium. So this, as I said, this is another most important physiological problem. So any problems happens that affects the meeting of the sperm and the egg, because there is fallopian tube problems, or if the sperm is not motile enough, or to reach up to this part of the fallopian tube, or if there is no ovulation. So, for any reasons, if this physiological process is impaired, then it affects fertility. So, that is why it's important that we understand the basic of fertility. So, this is the fertilization process, as I explained. It's the process that takes place in the fallopian tube of women, where the sperms unite to the egg. And that process is the fertilization. So we need only a single sperm cell to enter the oocyte of the egg to fertilize it. So after the embryo is formed, as I said, as the embryo reaches to the stage known as the blastocyst stage, which is the fifth day it happens after fertilization had taken place. It is another important process that needs to be done is the implantation process. So implantation process is the process where the embryo attaches itself to the uterine wall, and it grows as a fetus. So this any condition that can interfere with any of these events may result in infertility. So that is what we understand here. So the three basic important events is that ovulation, fertilization, and implantation is what is important for fertility. So any process or any diseases in the reproductive tract, or any hormonal dysfunction, or any male factor infertility can affect significantly any of these physiological processes, and that can impact fertility of a person. So the next is, so as I said, the critical factors that can affect infertility is any factor that affects the eggs and the sperm, or any diseases of the uterus and tubes. These are the major areas where, if there are any problems, it can affect your fertility significantly. So let's understand about the eggs first, and oocyte, or the eggs in a female's body. So it is very unique that women are born with only a limited number of eggs. So at birth, we have only around 1 million of eggs in the ovaries, and because and after that there is a process known as an attrition. So attrition is a process by which a woman, in a woman's body, as the woman is aging, there is a significant reduction in the number of eggs in the ovaries. So this process is a physiological process known as attrition, and it is a normal process in the process of female aging. So this process, as you can see, when a woman is in the uterus, during the pregnancy, in the fetus at 20 weeks, the stage inside the uterus, the fetal stage is when a woman, in the we have the highest number of the eggs in the ovary, which is 6 to 7 million eggs. And even at by birth itself, it reduces significantly by the process of anesthesia. By birth, the egg count is only 1 million in the ovaries, and during menarche, it reaches to some 3 to 4 lakh numbers. And there is a significant reduction after the After that, in the reproductive years, if there is a significant decline, and then menopause is only around 1,000, then these eggs are also not recruitable eggs. It's just an immature egg that is there. So there is a significant loss of ovarian function as a woman is aging. So what we understand by this is if we are asked and what is the best fertile age for a female, the peak fertility for a female is in the early 20s. So in between 20 to 24 is the where a woman is at her peak fertility, where the egg is of best quality and the egg is of best number. But both this quality of the egg and the quantity of the egg, they start declining after the early 20s, in the late 20s. But also it start declining usually from around 30 years to 32 years. But what we see significantly is this after a woman reaches the mid 30s, there is a rapid decline. There is a speed up in the process where the eggs is undergoing this process. So what we understand is there is a rapid decline in a woman's fertility after the age of 35 years. So about eggs. So what are the tests? So if we ask you how do we test our fertility? So there are tests for women and there are tests for men to assess fertility. So as we are understanding here about eggs, so about ovulation is an important process. The two important tests for us to understand the function of the ovaries is test for ovulation and to test for reserve. So testing ovulation and testing reserve is the two important tests for us to analyze the condition of the ovaries. So the test for ovulation, as we all know, is the oldest one is the basal body temperature method, where the woman checks her body temperature daily and documents it in a chart to understand if the ovulation has happened. So with the ovulation, there is a change in the temperature. So, but this is not a very reliable method of detecting ovulation, hence it is not practiced widely. So other is to commonly done test is to have this urinary LH detection where women can test the LH search, which is a luteinizing hormone search. If it is happening, then she can use this urinary detection kit for that to predict ovulation. But most commonly done one is this two, which is by scan we can track the growth of the egg inside the follicles. So we track the follicular growth in the ovaries and then we can predict ovulation by ultrasound tracking. And then the other commonly done blood test is to measure the level of this hormone progesterone in a woman's body so that we understand if ovulation has happened or not. So these are the commonly done, and then there's a uterine biopsy, which is also not commonly done. So the common test is only in, using an ultrasound to scan your follicles to identify if ovulation is happening, or to do this blood test post ovulation to see if ovulation has happened. So these are the tests for ovulation to assess the function of the ovaries. And next is to, as I said, is to measure the ovarian reserve. So reserve is the number and the quality of the eggs in the ovaries. To assess this, so as you can see, this is the ovary. When this is the ovary, if it has a normal ovarian reserve, it looks like this. Sometimes the number of eggs in the ovaries can be low for a woman's age, then it causes a low ovarian reserve. Sometimes there could be more eggs in the ovaries, especially with the condition known as the ovaries to grow. So this is what we test when we want to assess the ovarian reserve. So we do all these tests to assess the ovarian reserve or the egg reserve in the woman's body. So as said, age is the most common important indicator for fertility in women. So older age, there is a decline in the fertility, and there are so many hormone tests, and then there is blood test, and then ultrasound to detect ovarian reserve. But the two most commonly done tests are to detect your anti-hormone level in the blood. So it indirectly tells us how much is the egg reserve in the ovaries. And then this basal antibody count is the ultrasound-based test, where at the start of your menstrual cycle, the first 5 days of your menstrual cycle, we use an ultrasound to count these small follicles, which is known as the antral follicles in the ovaries. So for ovarian function, the two common tests are to test your ovulation and to test your reserve. And similarly for the uterus, it's important to assess the health of the uterus because there are several conditions that can affect the uterus health, like fibroids, adenomyosis, adhesions, and there are so many other problems that we want to rule out by doing an ultrasound to evaluate for. So uterus can be evaluated by a simple ultrasound, or a uterus can be also evaluated by other technologies like hysteroscopy, where a camera is introduced straight away into the uterus to assess the health of the inside of the uterus. Also, we take one MRI to rule out fibroids and other structural defects in the uterus. So similarly, we need to assess like how we test the ovaries and the uterus. We need to assess the health of the fallopian tubes for women to assess fertility. So there are several tests to identify the health of the fallopian tubes, but commonly done because we do not want more invasive tests initially. So the commonly done tests, the non-invasive tests are only X-ray dye test, which is known as the HSG, which is a hysterosalpingography. This X-ray test can help us understand if the tubes are patent or it is affected by any disease. And then the most commonly done is also the scan test, known as a saline sonography test. And if there are any suspicion for problems in the tubes, then straight away laparoscopy and a dye test is also undertaken. So as we understand here so far, so we need to test the function of the ovaries, we need to test the function of the uterus and the fallopian tubes in order to assess the female fertility. So next coming on to male fertility assessment. So the basic and the first and the foremost test to assess male fertility is to do this semen analysis testing. So semen analysis involves assessing a sample of the semen, both macroscopic assessment, also microscopic assessment to identify the sperm health is what is known as the semen analysis test. So it is an important test that on the first test we order for all the couple who present with fertility issues. And so what we are checking is the concentration of the sperms in the semen sample, and also we are checking for the motility, which is how the sperms are moving, and then we assess the morphology. Morphology is the shape of the sperm, so how are there any defects in the head, midpiece, or the tail is what assessed during the morphological assessment. So a holistic assessment of the complete semen sample sperm is important to understand any problems in male fertility. So any semen abnormalities, if it is identified, then it requires further evaluation. So further evaluation. So initially, as I said, it's initially evaluation of the female consists, male consists of the history and examination part, and then semen analysis is the first line test that we do. Based on the result of your semen analysis test, further evaluation may be necessary, especially the hormonal evaluation where we want to assess your thyroid, prolactin levels, your testosterone levels, and the pituitary hormone level is what is assessed. Sometimes ultrasound of the testes and scrotum is necessary. And then for some men, based on these problems, some additional testing is also important, including genetic testing and testicular biopsy. So this is brief about fertility evaluation. So, most of the couples, unless they try for a pregnancy, they do not actually are aware of the underlying fertility problems they are having. So, only after they try for a pregnancy, they are understanding that they have this fertility issues that causing, making them difficult to conceive. So, but it is not so. You have to identify your fertility status even before you try for a pregnancy, especially if you have any of these underlying problems. So, what are these potential signs that will tell us that there could be some underlying fertility issues? Especially your age, any women who is younger than 35 years, there could be underlying fertility issues. And women, if they have menstrual problems. So, menstrual irregularities is one of the underlying symptoms that is showing us that there could be some fertility issues. And of menstrual problems, we can say whether it is irregular cycles or whether it is pain during periods known as dysmenorrhea, or whether she's having very excessive flow, or if even if she's having no period at all, known as amenorrhea, any type of menstrual problems signals that there could be an underlying fertility issues and it needs evaluation. So it is important that women, if they have period problems, it is important they get their fertility assessed. And then both for men and women, if they are underweight or overweight, both can affect their fertility significantly. So it is important to maintain your body weight in the ideal body mass index category. And for a couple who is experiencing repeated pregnancy losses, also indicate that some issues which needs evaluation. So for which you have to seek the help of a fertility specialist. Any history of prior pelvic infection in women, or any sexually transmitted infection in men can affect your fertility. So it needs evaluation earlier if you have had a previous pelvic infection. So smoking and alcohol use both in men can affect your fertility significantly. Smoking in men can affect their sperm health. It affects the way the sperm carries the DNA. So it causes something known as a DNA fragmentation. So that can affect fertility and can lead to miscarriages also. Also, smoking in women can reduce their egg reserve. So smoking is something, it can not just affect your genital health, it also can affect your fertility or the reproductive health also. So alcohol similarly also can affect your fertility status. Also for some men, especially, and also for women, um, if there is occupational exposure to higher temperatures, or you're working in an environment where you're constantly exposed to toxic chemicals, then it can also affect your fertility. And also, if you are experiencing any sexual dysfunction, it also can signify some underlying fertility issues. Hence, if the men and women, if they are experiencing any of these potential signs of fertility issues, you need evaluation by a fertility specialist. So just to highlight only the menstrual issues, as I mentioned, for women, if they have issues with their menstrual cycle or period issues, it could be signifying a lot of different problems. So hence, any period abnormalities needs evaluation, especially in women in the reproductive age group, because this can signify a lot of problems. As you can see in this list, it can signify polycystic ovary syndrome problem, which is very commonly seen nowadays, causing anovulation and other hormonal imbalances in a women's body. And also weight issues, being underweight or overweight, both can affect your period regularity. Excessive exercises in women also affects their period by a process known as hypothalamic amenorrhea, and excessive prolactin hormone level in the body also can cause period issues, and low ovarian reserve and primary ovarian insufficiency. Both of which means that the egg reserve in the ovary is low, it affects your periods. And most importantly, thyroid problems also can present as menstrual abnormalities. So hence we understand for women especially, there are a lot of problems that underlie this symptom, which is the periods. Hence it needs evaluation of irregular periods. So how do we say or diagnose irregular periods is for a woman who is like 3 years after their menarche, if their period is coming within 21 days of your last period, or if it is coming after 35 days of your previous cycle, then it may signify irregular periods. Sometimes if you're getting less than 8 cycles in a year, that also signifies irregular cycles. So we come to the end of the session. I thank you all for your patience. So let's see if I have any questions. So if there are no questions, we'll conclude the session. I thank you all for your patient listening. So thank you. I'll meet you in the next session by Oasis Fertility.